Hi, I'm Dr. Mark Braun from the Sydney Implant Institute. Today we're performing a lower all-on-4 procedure on a lady called Lynn. Lynn has 7 lower teeth remaining. She was recommended by her dentist to have these lower teeth out and a full denture placed.
Well, I have no back teeth, no chewing teeth. So I keep chewing on my front teeth and they keep breaking, and I have to keep going to the dentist and having them repaired, and they've just come to the end of their life. I'm 70 years old. They've had it.
Lynn's been struggling with a partial lower denture for many years now, as most people do with lower partial dentures, and didn't really like the idea of having a full denture. What we're doing for Lynn is we're taking out the remaining teeth, smoothing over the bone, placing 4 dental implants, and later on this afternoon Lynn will be given a fixed, full lower bridge. And this will improve the way her lower teeth look and allow Lynn to eat such things that she hasn't been able to eat for a number of years now.
Twilight sedation is a conscious sedation where the patient is relaxed, comfortable, able to respond, but not bothered by the surgery that's going on.
So initially we use a local anaesthetic called Articaine. And what that does, and we use the machine called the Wand, which is a computer-assisted anaesthetic delivery system, which means that these injections are really painless. We make it all numb first, and then I use a longer acting anaesthetic which lasts 7 to 8 hours. So the very first stage of an all-on-4 procedure, you can have a look at these teeth. They're heavily filled, they're all obviously these white plastic fillings, because these small teeth are doing all the work at the moment because there are no back teeth. These small fillings are failing and fracturing and falling out. A couple of these teeth are dead and have infections at the end of them, and as you can see, there's just the aesthetic issue. The first stage is to remove the remaining teeth. These teeth have been removed, and it's by far and away the most traumatic part of the procedure. We have to use a lot of force. The actual implant part of the procedure is very gentle and very precise. The next thing we need to do, we need to remove this sort of infected gum that's been between the teeth, and we need to just expose the lower jawbone, or the mandible, which is obviously where we're placing our implants. The next vital stage, when we're doing it all-on-4 in the lower, is there are 2 nerves. They run through the lower jaw and they exit sort of about this position here. They're the nerves that supply the lower lip. And when we're doing a lower all-on-4, we have to identify those nerves, so we just know where they are and we keep well clear of them. So what we do now is we mark the nerve, so it's obvious for everyone, so they know exactly where it's lying underneath. The next stage of a lower all-on-4 is what we term the alveolectomy. And what that means, the alveolar process, is the bone that holds in the teeth. And this bone, I guess, is a bit like honeycomb. And one of the issues is you can see that how thin it is here, how bits are missing around teeth. This particular bone is removed. It removes a lot of the bacteria and the infection, and allows us to use the bedrock, or the harder bone, underneath. The other advantage of this, it means that our bridge will be taller. And the reason the bridge being tall is a good idea, it means it's stronger. The more bulk of material makes it a stronger bridge, which means that there's less likely of fracture down the track. This bone here is kept as well, and we use that. It's mashed up and we use it as a bone graft at the end of the procedure to fill in all the deficits in the bone. Last but not least, we just level it all off and make it nice and flat. So after the alveolar bone is made nice and flat, you can see how much flatter and neater that is. There's still just the tips here where the tips of the roots were, but you can see how that's going to form a nice flat fitting surface the whole way along. What's important now is we make sure we feel the bone and make sure there's nothing sharp or no sharp edges that can hurt the gum above it or actually cause a problem underneath our bridge. Okay, the alveolectomy is done. These are the teeth. And the teeth have been set up according to, we've had a discussion about colour, shape, and how far the jaws have to be apart, or how open the bite has to be. After we've done that, the technician makes this, and he puts the teeth that we're going to use later on the real bridge, but he puts them on a surgical guide. When we say surgical guide, it's something that seats back here. Now back here is important because we haven't touched that. It's not part of the alveolectomy, not part of the procedure. So this locates where the teeth should be, locates where the bridge should be, and we know where our implants want to be. We want to basically spread the 4 implants out across the bridge, with the last ones going through, usually depending on how big the jaw is, it goes through the top part of the last molar or slightly in front of it. So line up our surgical guide with where the bite has been determined. We can usually feel that. So by doing this, using our holes, we know exactly where to place our implants and what angle to do so. We use a pilot drill. It's just like putting a screw into a hard piece of wood. We've got the back ones, remember, at that 40-degree angle, 45 degree. We're going 15 mils there. We know the length we're going to, and we just use successively wider and wider drills until we're happy with the width of the hole, then we tap our implant in. What we're doing now is just removing the excess bone from around the top of where the implant's going to be. We call this countersinking. Now our next step is to tap our implants in. 15mm Nobel Biocare implant. These implants are made in Sweden. They just tend to be, we find, and they are. They're the most researched implant and one designed specifically for this procedure. Okay. So we know our angle. And just like a self-tapping screw, it'll actually find its way into the hole we've made. So you can see now the implants are placed. They're all at the same level. The next stage is to connect the connectors to the implants. We call them the abutments. We're using 17-degree abutments because we want to throw the screw hole back and just towards the in, so it goes through the centre of the teeth as we tried in with the surgical guide. We often use 30-degree abutments, but we're using 17 here because we don't have a lot of space back here. Now, try the surgical guide in again and just make sure that the angles, we're happy with the angles that they're pointing at. These are straight abutments. These ones back here are angulated. These are at 17 degrees, these ones are straight. Put them on, and then we just, okay, just torque them down so they don't get loose later on. We have our 1, 2, 3, 4 implants. The 4 connectors are placed. Bone's nice and flat and level. Next thing we do is we put little protective caps on top of the abutments so we can do our stitches without them getting caught on the abutments. And remember the bone we collected before, we put that through a milling unit to make it nice and fine, and we use that to fill in all the deficits and defects that have been created by the removal of the teeth and placement of the implants. So there you have it. You can see it's all looks quite neat now. The tissues have been closed with sutures. You've got the 4 implants and connectors, the connectors poking through the gum. And we move on to the next stage now, which is fitting of the surgical guide and the teeth, putting them in the correct position and doing impressions around it so the technician can manufacture the final bridge.
At this stage, with the surgery finished, we allow the sedation to wear off so that she can give us maximum cooperation to fit the new teeth.
So what we're doing now is attaching cylinders to our abutments, and these will be the way that the bridge gets attached to the connectors. Cylinders are in. Now we get our surgical guide. So now the surgical guide fits over our cylinders, and as we predicted or we wanted, we will have our cylinders close to our screw holes, as close as we can to these lower incisors, and coming through about the last molar. Perfect. We've attached temporarily the bridge to the 4 cylinders. We've got them in just about the right bite and right position. We might get it moved forward a little bit, and I think Lynn's bite needs to be open a bit, but that's something we relay to the technician and he'll do. In order to be able to do that though, he'll need a bite or a registration of how these bottom teeth are fitting into the top teeth. Good. Next thing we do, we need an impression. Up there, to be taken around the underside where everything's changed. So remember, it's really the underside of this that the technician will be doing most of the work on. So it's the bits that we've changed with the surgery. Yeah. So what we've done now, taken an impression of what's actually underneath the bridge. The bridge has been connected to these cylinders. This now all goes off to the dental technician to fabricate the final bridge. What we're doing now is just attaching sort of pretend implants to our bridge, so the technician can pour a model up. It'll be an exact replica of what's inside Lynn's mouth at the moment. He'll have impressions of the gums and tissues, he'll have the teeth in position, the bite, and obviously the abutments, which are on top of the implants. He'll have exactly what shape they're in. And that goes off to the technician. So here is the completed all-on-4 bridge. It's 4 p.m. in the afternoon, and this has come back from the technician. Our patient's been recovering since 11 in the morning and is still numb and in no pain at all. What we're doing, this is the bridge. The all-on-4 bridge not only replaces the teeth, but also replaces the missing gum and the missing bone. You can see 1, 2, 3, 4, where it's attached to the dental implants inside the patient's jaw. Lynn's been recovering in our recovering room, and all that remains now is for us to screw the bridge in, and hopefully it looks good and we're all done. Now at this stage, Lynn's still numb, aren't you, Lynn? Mm-hmm. We've screwed in 1, 2, 3, 4 prosthetic screws that are holding the lower all-on-4 to the dental implants inside the jaw. So just check the bite's right and click straight in. Open up there for me. Bite down. Beautiful.
Feels like I've got a very full mouth.
But you have. Bite down.
Oh, and these look wonderful.
Yeah. Bite down. They're good, aren't they? The reason you've got a full mouth, do you notice? Can you see how you've got less crease in here as well? Because I've opened your bite up. Yeah, because your bite was definitely overclosed. Yeah. What do you think?
Good.
Yeah. Yeah, it's good.
Keep all the way around.